Hi, everybody. It's Jessica Stone at Stansberry Research, along with Dr. David Eifrig, who is the editor for both the Retirement Millionaire and the Retirement Trader at Stansberry Research. Doc, I wanted to ask you, President George W. Bush, we've seen some reporting that he was so concerned about the 1918 Spanish flu that he got ready in a major way during his presidency for pandemics. Why was that flu so deadly? Because it's being talked about a lot right now.
Yeah, so it's a great question. And I think what you have to consider is back then we didn't have the incredible acute care facilities that you have in the United States today and other parts of the world. You didn't have antibiotics. You didn't have people devoted to the care if you needed acute care, let's say a ventilator kind of situation or ICU. Back then, your general doctor probably delivered calves and horses and did a whole bunch of things in the community. And the other part, probably the most important thing, is World War I was happening. And so there's some really good evidence that large movements of troops and young folks spread that disease as well. So that's probably one of the major reasons. And I think Bush, if he's a student of history, that's kind of the thing. That's the real event that sticks out with you and makes you worry about and wonder, could this happen again?
And of course, here we are, and it is happening again, maybe not as bad, but there are lessons that we learned that we took from 1918 that are affecting the response now. Can you talk about that?
Sure. I think the important thing, and we've written about it and talked about it now for probably about 5-6 weeks, and it's really critical that individuals think about themselves, not necessarily for the whole group, but that means you staying away from other folks that might have the virus that can give it to you, because if you can avoid it, as long as you can avoid it, that's a good thing. Probably most people, most of the world will eventually get this version of it. You just don't want to get it when there's no room in the ICU bed, should you or a family member need it. And so that's an important lesson. And as the disease back in 1918 moved around and across country, it turns out that several places back then did do social isolating and probably, it looks like, in retrospect, had better outcomes and results. It didn't spread as fast and didn't kill people as quickly and eventually died out.
And of course, there are positive economic effects of that as well. So that's another thing we're going to be watching as we go through this period of time in our own country and our own global history. Thanks so much for joining us, Dr. David Eifrig of the Retirement Trader and Retirement Millionaire. We appreciate it. And if you would like to see more content just like this, please subscribe to our YouTube channel or follow us on Facebook, Twitter, or Instagram. Thanks so much for joining us.
Thanks, Jessica.